We're looking at now in this afternoon's session is to develop involvement in research projects. How do we develop involvement in research projects? And we're moving into looking at the practical applications because we know we need to. Our national drug strategy here in Ireland and at European level says we need to, but it's to do it and to do it well, where it does get voice and listened to. So I'd like to introduce to you all our first speaker this afternoon, who is Dr. Emma Dorris, and Programme Manager for the Public and Patient Involvement Ignite Programme at University College Dublin. Emma's co-authored a number of articles on public involvement with a specific focus on preclinical and life science research. She collaborates internationally to help researchers involve those with lived experience to hear their voice. So I'm delighted to introduce to you Emma.
Great, thank you all. I suppose you're wondering what somebody whose background is life science research and biomedical research is doing here, speaking to you, but I'm really speaking in my role as Programme Manager for the PPI Ignite Network at UCD, really to give a background and just some general feel for the area that's developing in research at the moment, and then my two other panellists here will give kind of more concrete examples of what's happening. So, considering it's after lunch, I figured I'd start by asking you a question to see if you're actually awake or if that afternoon slump has started. So, we're talking about predominantly academic research, but research generally. Where do the research ideas, the ones that get funded, where do they come from? Anybody?
Policy.
Academics. Policy. Say again? Practice. Views, yeah. Nobody has said the people the research affects? Not one person? Because let's be honest, traditionally they didn't come from the people that the research impacted, the people that the research affected. And fundamentally what public and patient involvement in research is changing the systems and the ecosystem that we have in research so that practice changes, so that we become more democratic in our research, right from the research ideas that we take up and fund and progress through to how we conduct the research, right through to the impact that that research makes. And impact is something in research that's only kind of come to the forefront a lot at the same time that public and patient involvement has. So when you're an academic researcher, your currency is publications. And you would have seen it throughout. You have these little snippets of these publications. Do you know what's quite easy to measure? The amount of publications, the amount of money. Do you know what's really hard to measure? The impact that it's had. And that's a big part of the reason that the system has been the way it is. So part of public and patient involvement is driving ways to change that system, even though even the metrics that we have is working against us. So this is a quote. I don't use too many quotes, but I love this one. It's decisions made in the light of an adequate understanding of the issues are likely to be better, not right, but better than decisions made in the absence of such understanding. Seems pretty obvious, right? If we involve everybody that has different types of knowledge rather than just the ones that have knowledge that we say is, ivory tower knowledge, then it's going to be better. Our decisions are going to be more contextualized about research, and fundamentally, the impact of our research will be better. So this collaborative approach, working with the people that the research affects, in health and social care research, we call it PPI, or public and patient involvement. In other areas, it's a form of engaged research, but a lot of the underlying concepts are the same. Through this, I might slip into saying public. When I say public, I don't mean the general public. I mean the specific group of people that the research affects. Okay, so if I do slip into that, that's what I mean. It might be women aged 35 to 45 that are injectable drug users. It might be somebody living with an impairment. It varies by context, but I don't mean the general public. Okay, so what PPI does is it acknowledges and values, and that's a really important part, is that it values that there are multiple types of knowledge and multiple types of expertise in an area, and that can come from training, it can come from practice, but it can also come with living with an experience. And I know I'm talking to people here who are going, this is community engagement and we've been doing it for years and years. But in research, traditionally, we often haven't. And there's questions around why, if it's been so prevalent and so beneficial in interventions, has it not been so prevalent in research? But it's designed to foster the collaboration and fundamentally improve research and increase the ability of research to actually be used. So it switches that goal of having a wonderful paper published, which is academic currency, to actually having the knowledge generated through research used. So there's been lots to talk about this, though, through the culture. So how do we get beyond tokenism? It's not something that one person or one researcher or one community group can do themselves. It's about a system change. We've had people doing brilliant work already for many, many years in a system that works against them. But how do we get the systems changed in place to make that, instead of being an exceptional practice, to being a normal practice? And it has to be part of a wider research sea change. Okay, talked about academic currency. This is the amount of papers that mentioned public and patient involvement. From 1972, or a term associated with it, there were two. And in 2021, it passed 1,500. So what is it that's driving this change? So if anybody's interested, those two papers from 1972, only one of them had an abstract. And one was about dentistry. And its conclusion was that it was the involvement of patients in the choice of their dentures that led to their acceptance or not. So they're already showing evidence that involvement is possible in 1972. So why is it 2007 before we're even hitting 100 papers? So a lot of the reasons is the policy context, and I'm going to fly through a lot of this. But what also happened in this time frame? You had the AIDS crisis in the 80s. You had the movement towards the formalization of a lot of the human rights aspects. And also, you had the BSE scandal, and I'll explain why that's in there. But the AIDS movement and the ACT UP, which was the AIDS Coalition to Unleash Power, fundamentally made a huge impact in how clinical trials were run. So ACT UP had two branches predominantly. One that did radical protests during the times of the AIDS crisis. They also had the Science Club. Has anyone heard of ACT UP before? Sure, many people have heard of ACT UP. How many people have heard of their Science Club? The Science Club was a group of predominantly men who were HIV positive, who met in an apartment in New York and took it upon themselves to learn absolutely inside out the workings of the FDA with regards to drug approvement. I'm talking about medical drug approvement and how clinical trials are run. They prepared a dossier and presented it to the FDA, which fundamentally led to what's now known as the parallel track, which allowed early access to potentially life-saving drugs. And that process was sped up so significantly because this patient involvement group fundamentally changed the way clinical trials were and still are conducted. So this is one of the first really impactful examples of evidence where there can be a real benefit, and a real benefit to the community if you start to engage with the people who are making those research decisions. In terms of BSE, BSE was an odd one. Do people remember BSE? Yeah. It was an odd one in that the agricultural policies did what they were supposed to. The risk communication was an absolute disaster. They didn't quite lie to the public, but they very nearly did. And it led to a long-lasting health scare. In combination with other things that were happening at the time, it led to the revamp of how these communications were done, increased transparency, things like the development of service user groups in governance. This all came around partially on the back of the absolute risk communication disaster that was the BSE crisis. There were other factors in it, but there was a clear through line across to it. And things like Involve Network would have come out, what was then the NHS Consumer User Group, I think it was called. And then you have things like the UN Convention on the Rights of People with Disabilities. So this took decades, whereas you're talking about ACT UP happened quite quickly. This took absolutely decades to get across, and of course for Ireland even more than it possibly should have. But one of the reasons I have this here is because it officially changes how we view research, particularly medical research, from a biomedical model to a social model. And that's really important because it is recognizing the external factors and not just those easily measurable biomedical factors in research. In terms of the research context, we have what's known as responsible research and innovation in Europe, which was a key action for a number of years over the previous EU research programs. And they spent about 50 million per year on looking to see if these 6 domains of responsible research and innovation actually made any difference. And the goal of RRI was that societal actors, which includes researchers, which is a really big thing because often we do research and society as if we're not part of it. So social actors work together to better align the needs that we have and the expectations of society. So within this, I'm actually going to run past this quite quickly, is we have the 6 domains: ethics, genders, governance, open science, public engagement, and science ed. Within public engagement, they classify what we call public and patient involvement. And this confuses a lot of people because they think of public engagement being, I've written a media article, I've told you how wonderful my research is, I've involved you, which isn't what we're talking about. Fundamentally, when we talk about involvement of the public or the service user in your research, there has to be a level of influence on the research. Consultations can absolutely have no impact on research. You can do them, but they can also be completely not influential depending on how you use them. So when you're talking about involvement, if you're wondering whether something is involvement or not, that key one is there influence on the research and is there a degree of decision-making by all the parties involved? That's involvement. Otherwise, it might be consultative, which might be better than what you had before, but you're not changing the dynamics of who controls research. Okay. In Ireland, one of the biggest movers has been the Health Research Board. So they terrified all researchers in health and social care research in Ireland by asking a question about how you involve the public or patients in your research. That's all they did in 2014. And did it send the cat among the pigeons? And they have done a stepwise approach to include members of the public throughout various aspects of how they both assess research, but also what they expect from their researchers. But in addition to the big stick of saying you need to it, they also had some carrots as well. And that's where what I work for now, the PPI Ignite Network, came up. So we're a national network now. It wasn't originally, but we've moved to a networked model, which involves over 64 partners in total. In the lead site, there's 7 universities. Now, looking at this, you can immediately say, well, why isn't one of the lead sites a community partner? It absolutely should be. If we were doing it again, I think it would be. But we have 10 national partners as well, including a number of different community partners. And the idea is that the way I like to think of it is, on the ground, we have lots of people doing wonderful work, okay? Building individual people, building really good practices of how to involve. From the top down, we're seeing that there is movement, both in the governmental level, the European level, and the funding, national funding level. And yet we have this bottleneck. What do you think that bottleneck is? It's the university systems and structures, okay? University systems and structures that support research have been there for a long time and have been designed and developed in order to support the traditional structured views, the way it was traditionally done. So what I see at the National Network is breaking down those bottlenecks So actually developing structures to make it easier for any community organisation and any researchers to work together without having to go through the nightmare bureaucracy of a system that is not set up to allow them to do that. So I'm just going to give one example here, is that we are able to give out, as part of our grant, we have it that we can give out seed funding to start to develop relationships between community partners and researchers. If you notice, this year's one was equality of opportunity. Why do you think we picked equality of opportunity? It's because although we have come very, very far in the amount of people we involve in research, the people who by and large are involved with researchers look just like the researchers. They're white, they're middle class, and they're highly educated by and large. So although we have broken down a lot of barriers in terms of getting that community involvement going, there is still a big barrier on getting those seldom heard voices in place. And that's because traditionally we need to be able to build the trust that we would have lost. That takes time and it takes resources. So we specifically did this, and it had to be a collaboration between community partner or an individual and a UCD researcher. Either could be the budget holder. And we have a big thing. We think give both the budget, because budget is the power. 3 of the 4 that we funded, the budget holder was the community partner. We find that a big success. Okay, I think it's important that we were able to have the systems in place to allow it to be the community partner, and also that we had collaborations together where they were comfortable enough to give away the money, holding the purse strings. So they focused on intellectual disability, the experience of rural homelessness, acquired brain injury, and families with vulnerable children. So part of the reason that the network is done this way is that it allows each of the network sites to build up specialities within engaging with certain types of communities that every other member of that network can then learn from. So it takes away the competitive part a lot, and it allows a true learning environment so that people can genuinely learn from each other and work together. So for example, in UCD, we do an awful lot of work with what we call seldom heard communities. So this would be people living in homelessness, it would be people with rare diseases, and you would have seen that our good colleague Sarah Morton there, who would be at UCD as well, does an awful lot of work in gender-based violence as well. And because it's this networked approach, it allows us to build up the structures and supports and share them. And it's that sharing aspect. So if any of you are here today and interested in getting involved, there are people now, supports there that you can reach out to for greater support in research. They're being built, and they are not perfect by any means, but we're getting there.
Thank you, Emma. Look, that was really, really interesting insofar as it was giving us another lens to look at research and the potential through network and access through to integrated public participation involvement as well. And I think your question at the end, if anybody's interested, I was waiting to see a few hands going up saying, yeah, I'll talk to you. Just in terms of access, because it can be difficult as a practitioner perspective. It can be difficult. Sometimes we do have access to service users' voices, but it can be difficult then to actually action and turn that into research.